Welcome to our annual review for 2016-17. We can look back with pride and gratitude on another rewarding year for the Trust. As always, our successes have been the product of the compassion, care and commitment of all colleagues across the Trust. The dedication shown by great people across the organisation really is a privilege to be part of. Overall, in 2016-17, the Trust had over 1.4 million contacts with service users. That equates to over 3,800 people every day. In simple terms, that means on average, Gloucestershire's population of 635,000 people uses our services at least twice a year. This is a really incredible statistic achieved by a workforce of around 2,700 people. We provide a fabulous range of community-based services for people living in Gloucestershire. As I'm sure you'll be aware from national media coverage, NHS clinical colleagues are under real pressure. The number and complexity of patients we're caring for continues to increase. We also know that some areas and types of jobs are hard to recruit to, so it's important to recognise their amazing contribution in delivering our outstanding community-based services. Our children and young people services include health visitors, physiotherapists, occupational therapists, speech and language therapists and community nurses. We also have a very dedicated and skilled team providing complex care for children in their homes and a team of school nurses providing a comprehensive range of services to children in their schools. Our integrated community teams, social workers and reablement workers from Gloucestershire County Council working with our physiotherapists, community nurses and occupational therapists provide invaluable support to individuals to help them maintain their independence in their own homes and in local communities. Our 7 community hospitals provide a great offer for people who need inpatient rehabilitation or care that doesn't need to be provided in one of the acute hospitals in Gloucestershire. We also work with our partners in Gloucestershire Hospitals NHS Trust to provide a wide range of outpatient services supported by X-ray, and we're incredibly proud of our minor injury and illness services. And adult county-wide specialist services, including specialist nursing, physiotherapy, occupational therapy, speech and language therapy, podiatry, musculoskeletal services, and our sexual health and community dental services, providing a comprehensive range of services for adults across Gloucestershire. It's always important to remember that behind the scenes, we also have a dedicated and hard-working team of administrative and clerical colleagues. While many of these great support service roles are seldom seen by our patients, they really are a major contributor to the success of the Trust, with many unsung heroes keeping everything on track. 2016-17 was an incredibly busy year for Gloucestershire Care Services NHS Trust, and there is so much to be proud of.
In June 2016, Simon Sester and Stroud were successful in getting joint accreditation for their endoscopy units. This is from the Joint Advisory Group. It is the gold standard. We now join the 12 community hospitals nationally, which is a huge achievement for us. This really shows how much our services are patient-centred, we value staff, are safe and effective, and we listen to what patients say to us.
In September, we premiered our film, Getting It Right, at a local independent cinema in Gloucester. It's a short film about the importance of end-of-life care. Palliative and the end-of-life care must be a priority for everyone, and it requires collaboration and cooperation to create the improvements we all want. I am very proud to say that our Trust does this very well. It meets the needs of people of all ages who are dealing with dying, death and bereavement, taking into account their priorities, preferences and wishes.
2016-17 has been a particularly good year for infection prevention and control, with excellent place results across Gloucestershire Care Services and NHS Trust. We've also managed to maintain above 95% hand hygiene compliance on a monthly basis in each of our inpatient and outpatient units, as well as theatres and endoscopy suites. Our audit results are on the up and infection rates are low, with us remaining within trajectory for our C. diff cases for the year.
In March, the Trust was awarded the Investors in People accreditation. In the report, it stated that this was a significant achievement, especially in light of the spread and diversity of the Trust across the county. Furthermore, it was highlighted that the Trust continues to work to its values and that in this aspect, practice is advanced and very close to high performing.
The Trust has made a significant investment in its minor injury and illness units across the 7 community hospitals. Over the last year, there's been an introduction of the matron post within the minor injury and illness units, and there has been significant investment in the training and development of our colleagues that work within the hospitals and the minor injury illness units.
From a performance perspective, we met or exceeded over 90% of our national targets, which we believe is a great achievement and reflects our genuine desire to deliver great services and to do so within the resources that we have available. Just a few highlights: 100% newborn hearing screening coverage, 100% of patients waiting less than 6 weeks from referral to a diagnostic test, and 99.6% of service users attending our minor injury and illness services were seen and discharged within 4 hours. Throughout 2016-17, we've been really focusing on ensuring that all of our services work seamlessly with local primary care general practice teams across Gloucestershire. We think that's really important to provide everybody with joined up services that really can support their health in their local communities. It won't come as a surprise to hear that, like all trusts, we've had a big financial challenge in 2016-17. Our teams have had to pull together and come up with lots of ideas to achieve our targets, but we have achieved them, and that means not only do we have a big green tick, but we also achieved a small planned surplus of £2.2 million against an income of just over £112 million. While the great performance in 2016-17 to achieve that surplus can't be underestimated, we know that the future is going to be equally challenging if we're going to sustain our quality services within the resources that we have available. For 2017-18, we know that we're going to be looking to save a further £4.6 million to be able to feel confident about continuing to deliver services within our resources. In 2016-17, we spent just over £3.5 million to improve our buildings and equipment. This was in line with the plan that we agreed with NHS Improvement, our regulators. Some of our projects included hospital refurbishment, particularly in Stroud and Cirencester, and some new information technology solutions to support our team's work in a more mobile way in people's homes and in the community. While we know that our colleagues working in the Trust are incredibly proud of the services that we're able to provide, we know as well that there's more that we can and must do to help make this a great place to work. Our annual Understanding You Awards were the biggest to date, and we will continue to see this grow, recognising colleagues who've excelled in their performance, promoting teamwork and inspiring others to excellence. We know from the National Staff Survey that colleagues working in the Trust are incredibly proud of the services that we're able to provide. It also tells us that whilst we're performing above average in the country, there are a lot of areas that we still need to improve to make it a great place to work. And improve them we will, because we know without happy, dedicated teams, we will not be able to continue to provide the world-class services that we pride ourselves on. So, as we've taken the opportunity to look back through 2016-17, we really can be incredibly proud of what everybody has achieved. And certainly joining the Trust in January, I couldn't be prouder and more privileged to be leading this organisation. As we look to the future, I feel we can do that with great confidence to build on those achievements. We know it's not going to be easy and there will be more challenges ahead, but with the commitment and dedication of our staff, working in a caring, open, responsible and effective way, I think we can really look to the future with great confidence.